In the fifth and final section, now we will discuss about the parapharyngeal abscess. And what are the causes of parapharyngeal abscess, what are the clinical features of parapharyngeal abscess, and the treatment and complication, same as we discussed all like parotid abscess, then we talked about the Ludwig's angina, peritonsillar abscess, and the retropharyngeal abscess. Now the parapharyngeal abscess, which is around the pharyngeal area, and what are the causes of parapharyngeal abscess, how the patient will present, and how we treat, and what are the complications. So parapharyngeal abscess is the abscess of pharyngo-maxillary or lateral pharyngeal space. So parapharyngeal abscess is the pharyngo-maxillary or lateral pharyngeal space. Abscess is the parapharyngeal abscess. In this diagram, this is the picture that gives the different location of different cranial nerves from where they cross or pass. So all these are all in the surrounding portion also, so they are also affected as a result of the parapharyngeal space abscess. Causes are in the pharynx, we have acute and chronic infection of tonsil and adenoid and bursting of peritonsillar abscess. So the causes of parapharyngeal abscess can be due to the acute and chronic tonsillitis, infection of the adenoids, and then any bursting of peritonsillar abscess. We already talked about peritonsillar abscess, which is in the space between the capsule and the superior constrictor muscle. If that bursts out and it moves, then it can cause the abscess in the parapharyngeal space. Teeth, dental infection usually comes from the lower last molar tooth. Ear, bezold abscess and petrositis. And then other infections like infection of the parotid, retropharyngeal and submaxillary space. All these infections can lead to parapharyngeal abscess. So make sure that whenever these conditions are present, there are chances that they might end up leading to parapharyngeal abscess formation. External trauma like penetrating injuries of the neck, injection of local anesthetic for tonsillectomy or mandibular nerve block. They can also cause parapharyngeal abscess. Clinical features include the prolapse of the tonsil and tonsillar fossa, trismus, external swelling behind the angle of the jaw, because there is behind the angle of the jaw, this is the area which is the parapharyngeal area. Bulge of pharynx behind the posterior pillar, paralysis of cranial nerve 9, 10, 11 and 12 and sympathetic chain. In the first diagram we saw all these cranial nerves are crossing in that surrounding area. So whenever there is abscess in that and that swelling cause pressure on these cranial nerves, it can cause paralysis of these cranial nerves. Swelling of the parotid region is also present. So these are all the clinical features associated with parapharyngeal space. All that surrounding space is affected. Complications include Acute edema of larynx with respiratory obstruction, swelling of the larynx can cause obstruction of the respiratory obstruction, and it can also maybe in emergency need tracheostomy for easy breathing. Thrombophlebitis of jugular vein and septicemia, spread of infection to retropharyngeal space, spread of infection to mediastinum along carotid space, mycotic aneurysm of carotid artery, and carotid blowout with massive hemorrhage. So all these are the complications of parapharyngeal abscess. All these abscesses, if you notice, they can lead to respiratory obstruction because of the swellings present, and they exert the pressure on the trachea and they can cause obstruction. And then also they can cause septicemia, which can be very serious sometimes, and it's hard to treat once the infection reaches the bloodstream. Then also we have a spread of infection to the to the surrounding areas, and there are localized features present. Treatment are the systemic antibiotics, drainage of abscess. That was all about this section, and that concludes our topic of today, which is the infection of the head and neck spaces, in which we talked in detail about these abscesses of the parotid abscess or parotid space infection. Then we talked about the infection of the in Ludwig's angina, cellulitis or connective tissue infection of the submandibular, sublingual and submental space infections, and how they spread and how they are treated. Then we talked about peritonsillar abscess, how it is treated and what are the complications. And then also retropharyngeal space, which is behind the pharynx, and the parapharyngeal space. So the overall picture of all these infections is pretty much the same. Patient is usually in the they have general features and the local features also. General features are because of the toxic appearance of the patient, because of the high grade fever associated with infection. And treatment options, almost all of these are treated by incision and drainage, and then we should treat them with the antibiotics, IV antibiotics, or proper dehydration. But one condition which is due to the chronic retropharyngeal abscess is, we said, is mainly due to the caries of cervical spine and the chronic infections like tuberculosis, and in that case we need to treat the condition with anti-tubercular drugs. So that concludes our lecture. Thank you for watching sqadia.com.